Hi, this is Jeff Peterson. I'm going to introduce the concept of high deductible health plans. Doing this because as health coverage rates are going higher and higher, many of our clients have moved to plans that cost less. And if you're covered by your company, you probably don't notice the high costs unless you have to pay for a family, which most companies don't pay for, and then you do notice the higher costs. So, if you want to move to a plan that costs less, how are you going to compare, or how do you choose between two plans? This video is an introduction to why you may want to choose a deductible plan or even a high deductible plan. I'm going to compare two actual plans from Kaiser Permanente, a health plan that many of our clients use, and both of these Kaiser Permanente plans are popular. You can choose either one of these in certain circumstances, and that could be the right choice for you depending on your needs, and that's the whole point. We want to help you choose what fits you the best. It's important to say that I'm not an employee or a spokesman for Kaiser Permanente, but I am an authorized independent agent, and I explain this concept to my clients pretty often, so I put it on this video for convenience. Okay, the two plans are the $30 copay plan and the $30-1500 plan. Now, the 30 copayment plan is very popular. In fact, this is the most popular Kaiser Permanente copay plan. The $30-1500 is the most often selected plan by our clients when they choose to go to a deductible plan. They have differences and similarities, and I think I'll take you through what's the same first. First, they both have office visits for $30 and also preventive, maternity, well child, vaccines. All these are without a deductible and they are all the same. I'm going to switch over to the $1500 plan and you can see they're all the same. Now these are not subject to the deductible. Also, they both have pretty good prescription coverage. Show you down here at the bottom. Generic prescriptions are $10, brand name are $30. Interesting, on the $30 copay plan, there's no deductible for medical like hospital, but there is a prescription deductible. If you get brand name, then you have to pay the first $250. Alright, that's what's the same. And here's what's different. If you are very sick or injured, you'll go to the hospital on this plan and pay $400 per day with no deductible. On the $30-1500, if you go to the hospital, you will pay $500 per day after the deductible. So you're going to have to pay more to use the hospital on this $1,500 plan. First you pay $1,500 deductible and then $500 a day. Both of these plans have a maximum out of pocket. So if you go to the hospital for 10 days, you'll pay $3,500, not $5,000, because $500 a day for 10 days is $5,000. Here we see your limit is $3,500. There's a limit on the $30 copay too. On that plan, the maximum out of pocket is $3,000, so they're nearly the same. On the one plan, it's $3,500. On this plan, it's $3,000. So why would a person choose between the two? And the answer is money. On this plan, you pay $596 per month, and this is an actual example for a given age and zip code in California, but our example family is $596 per month extra to have this, and $369 to have this. So in other words, this family saves $227 per month to choose this plan, and that's $2,724 per year. So what happens if a person in the family gets very, very ill? Well, on this plan, they're going to pay until they hit $3,500. On this plan, they're going to pay until they hit $3,000. But notice the difference. On the $30 copay plan, you haven't saved any money. On this plan, you've been saving $227 per month. So If you end up with one person in the hospital, you have saved $2,724 that year. That helps you to pay this. If you choose this plan and someone ends up in the hospital at $400 per day, then you just have to pay the $400. There isn't any monthly savings that you've saved up to cover that cost. Now, I'm also going to give you two other examples. There are people that we have helped to choose these kind of plans in years past. One was Kathy, who 2 years ago moved to a plan like this because she saved about $200 a month. She's been on the plan over 2 years and had one emergency, but it was not medical. The emergency was dental, which isn't covered on a health plan. So Kathy was happy because she had $2,400 in savings she could use to pay for her dental emergency. She likes this kind of high deductible coverage much better, and other people in her company are also moving to this kind of high deductible plan because of her example. Another person is David Grant, a professional businessman and university professor who switched to a high deductible plan we showed him over 2 years ago. He explains that he built a matrix, an actual worksheet that he could compare every possible event for his high deductible plan to see what it would cost him over every year, no matter what happened health-wise with his family. He found that he saved money even if the worst did happen, and the last 2 years he's saved thousands of dollars. You can also see David's video here. We'll show you. At this point, you might have questions about your specific situation, and I encourage you to call me at 1-800-655-9525. Kaiser Permanente offers more plans than this because every family is different, and you may want another plan altogether, like a health savings account or a PPO, and we can discuss all those options for you. So, this concludes the idea of a high deductible health plan and why a person might choose it.